Welcome to Medicare for All Explained. This podcast will enlighten our listeners and dispel the distortions that surround Medicare for All. Medicare for All Explained is produced in collaboration with Physicians for a National Health Program and is hosted and produced by Joe Sparks. I'm your host, Joe Sparks. This is episode 131, Helpful but Should Be Unnecessary. In July of last year, a new Virginia law took effect. It is known as the Virginia Medigap Birthday Rule. Medigap policies are also known as Medicare Supplement policies. The law allows people who are on Medicare and have Medigap policies to switch to a comparable plan type without underwriting. The new law has saved me over $97 per month and saved a friend of mine almost $150 per month. Please note that I am not going to discuss the details of Medicare. Instead, I will focus on the parts related to Medigap policies. I will get to the details later, but first, I want to give some background information. Medicare is the government-backed insurance program that covers seniors who are 65 and over. There are two main types of coverage with Medicare: Original Medicare with a Medigap policy and Medicare Advantage. Advantage plans are private insurance policies paid for by the government. In previous episodes, I have covered the problems with Medicare Advantage, or as I like to call it, Medicare Disadvantage, and why Original Medicare with a Medigap plan is a better choice. I will not be discussing those details in this episode. While Original Medicare covers the full cost of some inpatient care, Medicare only covers 80% of the cost for outpatient care, and the patient has to cover the other 20% with no limit on the maximum out-of-pocket. There is also a deductible for Original Medicare. Medigap plan types reduce these out-of-pocket expenses to varying degrees. A couple of the plan types do limit the maximum out-of-pocket expenses. Of course, the more benefits you receive, the higher the premium. I have a Plan G as in golf. Plan G covers almost everything except the deductible. When you first enroll in Medicare, you can either enroll in Medicare Advantage or enroll in Medicare with a Medigap plan without underwriting. And your rate was set based on the community rating. If you choose Medicare Advantage, you had 12 months to switch to a Medigap plan without underwriting. Here is the catch. Once you enrolled in a Medigap plan, or after 12 months in Medicare Advantage, you could only switch to a different Medigap plan with underwriting. This allowed the insurance companies to deny coverage or set the rate so high that you could not afford Medigap coverage. Most Medigap plans raise premiums as you age, and these increases can be substantial. Virginia Medigap's Birthday Rule allows you to switch Medigap policies that have the same plan type without underwriting on your birthday. Virginia Medigap's Birthday Rule allows you to switch Medigap policies that have the same plan type without underwriting on your birthday or within 60 days of your birthday. Since I have a Plan G, I can switch to another Plan G. As I mentioned previously, I am saving $97 per month, and I have a friend who switched plans and is saving almost $150 per month. There are several other states that have similar programs. I have listed the states in the description for this episode. The specific enrollment periods and details vary by state. So while my friend and I are thrilled to be saving money, it takes time and effort to determine what company to use. Then you have to notify all your doctors of your change in insurance. A single-payer system would make all this rigmarole unnecessary. You would be covered for life, and you give your physicians your information once and are done. Notifying my medical providers has been a pain in a place lower than the neck. I appreciate that Virginia passed a law that allowed me to save over $1,100 a year, but I am also annoyed that I have to spend time on tasks that would be unnecessary with single-payer Medicare for all, especially when Medicare for all would save me more money, provide better coverage, and free me from the hassle of having to decide which insurance policy to buy. Thank you for listening. You have been listening to Medicare for All Explained. Remember to tell your family, friends, and colleagues about this podcast. Information about Medicare for All Explained can be found at our website, medicareforallexplained.org. The music for this show is Super Bubbly by Jesse Spillane. The logo was created by Lily Sparks. Thank you for listening.